presentation goes forward. But I would say probably good to hear what Sue has to say first and then see if your question is answered or not. As you know, at ElderWorks, we help seniors and families. We're a resource center. We do not charge for our services, so feel free to call us. I've put my contact information in the chat box and I will add it again. We are live streaming this on Facebook, and you can then again see it on our YouTube channel as well. At this point, I'd like to introduce Susan Grossinger, a trusted partner of ours and just a terrific gal that works with us and our clients, Senior Services Coordinator at Advocate Aurora Health. And Susan, thank you so much. Please be sure that you're muted during the presentation, everyone. So Lisa, will you please mute yourself? And we'll continue from there. Thank you, Sue.
Thank you. I'm glad to be here. It's good to see you, Carol, and looking forward to, spring when we can get out a little bit more already. I'm already done with winter. But I appreciate you letting me come and talk about fall prevention. I'm going to just briefly give a little bit of a blurb about myself and why I'm talking about this. I am the Senior Services Coordinator at Advocate Good Shepherd Hospital. I've actually been here 21 years. I've aged in place. And I do several things here at the hospital. One of them is I am a SHIP counselor, so I do a lot of Medicare counseling and navigation, but I'm also a master trainer and have been since 2012, but I've been coaching Matter of Balance classes since 2008, where it is a Matter of Balance is a class that tries to help everybody individually figure out what it is that they need to do to lower their fall risk. And that's kind of the title of Matter of Balance. Is it's not a balance class, it is a matter of balancing your life. So between all the different things you need to look at and maybe make some changes, it's not just one thing. And that's something that we're going to talk about here in the presentation. There are some things I would talk about and stand there and show you, and but it's harder to do on the little screen, but so I'll do my best, I promise. So let's go ahead and get started. We're going to talk about how do we lower our fall risk, okay? When I do a presentation in person, I usually ask everybody, how many people here have fallen? I'm one of them. I raise my hand. And then as a result of possibly falling or, maybe, almost falling, I always ask, how many people are afraid that they may fall? So also, when people do fall or they do get concerns about falling and they do get maybe get afraid of falling, how many people have changed their lifestyle because of that fall or because of their concerns or fear of falling? There's my little turtle. So, and there are a lot of people, I have asked people before, a lot of people think, oh, it won't happen to me, it happens to everybody else, or, oh, well, I fell, so what? I've even had people where I've asked, have you fallen? And people have said no, but then as we're talking, they tell me about the time they fell, and then their husband went to pick them up, and the husband fell on top of them. So, but when I asked if they had fallen, they said no. So, there's a little bit of misconception about falling and how serious it can be and how much it can impact our lives. And so I guess what I like to do first when I talk about fall prevention is, I always thought it was not a big deal either. But during my life, I hate to admit it, I have fallen down my stairs, whether it was in my house or stairs going outside or into my garage. I have fallen about 4 times. Couple times it was when I was a young mother, and guess what I was doing? I was carrying laundry. So was I paying attention? Probably not. And I fell down to the landing and missed because I missed stairs. And I would like to ask, if I had the time, how many people have actually missed a step or two? So the issue here is even today, over the last probably 10 years, as I've gotten older, actually before, knock on wood, I became a master trainer. I did fall a couple times as well. Um, you know, I work out 3 to 4 times a week. I'm very active. I can stand on one foot and balance and close my eyes. So why have I fallen? I'm in good shape. So it's not just changing your physical activity or getting strong. There are other reasons why people may fall. So what I had to do when I had fallen and when I became a master trainer, I started to think about what are my fall risks? Is it that I'm not active? No. Is it that I don't have strong legs? No. Probably the fact that I'm active and have strong legs because I work out and I ski and I golf, but that has prevented me from getting hurt. So being active, doing walking all the time or doing some kind of activity can increase your strength, your flexibility, which impacts your balance, which can prevent, even if you do fall, could prevent you from getting hurt. So when I took a look at myself, my husband just used to say I was a klutz, but why did I fall? Well, you know what? At 5 o'clock in the morning when I'm going downstairs to get ready for going to work, did I turn the light on in the hallway to go down the stairs? No. Okay. Number one, fall risk. Um, I used to have two Akitas. I have one Akita. He's 110 pounds. Was I paying attention to him? Because he knows what I'm getting up and I'm going down the stairs. Hey, it's food time. I'm going for a walk. So he's running around me as I'm walking down the stairs. There's dog toys. Did I pick up all the dog toys on the stairs? Not necessarily the night before. And for me, the number one thing, besides the fact that I didn't turn the light on, was, am I paying attention? No, I'm not. I'm thinking about when I'm going down my stairs, I was thinking about everything else I need to do once I get down the stairs. And then also even what I'm doing when I'm getting to my office. So as of the last time I have fallen, guess what? Every morning, I approach my stairs. I am remembering to turn the light on. I'm remembering to pay attention. I'm remembering to look at the stairs as I'm walking down them. That is my main focus. Wherever my fall risk was, my main focus is to pay attention to what I am doing and to keep things clear. So for me, that is my fall risk. Those are my faulty behaviors that I do that I have to work on every single day. And we're talking, it's 2023. I've been a master trainer for 11 years. So every single day, I am paying attention to decreasing my risky behaviors so that I don't fall. So it's very important for people to understand, and I know if I may be preaching to the choir, and I apologize, that, the statistics are 30 to 35% of people over the age of 65 fall each year. Those who fall are 2 to 3 times more likely. And 1 in 5 falls cause serious injury. There is a reason that nationally people are paying attention to falls. The leading places for falls for hospital admissions, meaning when people come to our emergency room, 60% of those falls occurred in the home. So is our home always the safest place? Maybe not. Is our behavior, good to prevent falls? Maybe not. And then falls that result in fatalities, 60% occur in our home. So because of that, it is so important for people to not just say, oh, I'm a klutz, or, well, I like where my chest is at the bottom of my bed on the, I don't care that I bump into it all the time. I'm not going to move it. Well, you know what? If you're bumping into it and you're falling, maybe you do need to start taking a look at how your furniture is arranged. One little thing can make a difference. Also, what happens when people are in the hospital as a result of a fall? 39% end up going to a skilled nursing facility versus 33% go home. Now, most people, when they fall, may not die. It's a lower percentage. However, the result of that fall can make major changes to how we live our life. And that is what is so important, is we struggle, and we all our life, from the age of 2, we fight for our independence. Well, as we get older, we think we're doing things because we're holding on to our independence. And actually what we're doing is we're putting our independence at risk. Some of those things are, you need to ask for help. You maybe need to have somebody else do something for you. I will tell you that I have struggled with getting up on counters to kill spiders, because I'm deathly afraid of spiders. I have vaulted ceilings, and I have made a point, even though my husband does a terrible job of killing the spider the way I want him to kill it, I don't kill that spider. I have my husband do it for me. Even though before I used to climb on my bathtub, climb on my actual, counter bassinet to kill that spider. I do not do that anymore. And very rarely will I allow that spider to live. I know people have told me I need to do that, but anyway, so I am finding things that I should not be doing, that I give either to other people to do, or I don't do it anymore at all. The types of injuries here, this is Advocate Good Shepherd Hospital, that come to our emergency room. You can see that falls outweighs all the other reasons that people come to the hospital. Here's the other thing. People over the age of 55, not 85, but over the age of 55, account for more than half of the injuries that come to our hospital. So even though we're in our, mid 50s, we still are at risk for falling and having consequences for that fall. Trauma death mechanism. Of the trauma-related deaths that occur at our hospital, 80% are a result of falls. 80%. What are the causes of falls, and what can we do to prevent them? And I'm going to talk about, prevention. But if people are not willing to make those changes, that is where we run into problems, where those things that you do that probably put you at risk, you got to make those changes. It's not easy. This is a marathon, not a sprint. And it's not something that you could say, oh, well, I did this one day and never do again. It is something that these things have to be incorporated into your everyday life to lower your fall risk. So the risk factors, usually it's 2 or more that interact that cause a fall, such as poor balance and low vision. I kind of like to say, also home and environmental risks play a role in 50%. So I always like to say, you got your sun, your moon, your stars, all in alignment, and that's why you fall. But if you take one of those elements, or two of those elements out of the equation, you may not fall next time. So it's very important to take a look at what your risk factors are. And risk factors are individual. It's important for everybody to take a look at themselves, not the other person. What may put me at risk may not be what puts others at risk. There's modifiable risk factors. So we have biological factors, like our leg weakness, mobility problems, problems with balance, and poor vision. Those are modifiable. And I will tell you, I once had a dietitian tell me, and this is so true, that, sometimes as people get older, they start to eat not as well as they did before. So for example, protein is very important, not eating a huge, steak, but eating protein every day. Protein is what feeds our muscles. Our muscles feeds our strength. Our strength feeds our balance. So this equation of staying healthy, eating right, keeping ourselves, maybe doing activity that works on our weaknesses, our leg weakness or our muscle weakness, can improve your mobility and your problems with balance. Now, those are modifiable. We will talk about things that are not modifiable. Behavioral, are you taking more than 4 meds? Are you taking psychoactive meds? Are you still doing risky behaviors? Are some of your, are you inactive? Okay. One of the theories around increasing your fall risk is, and that was seen through the development of the Matter of Balance class, is if people get concerned or fearful about falling, guess what they do? They think if they don't do things, they will lower their fall risk. But actually what that does is increase your fall risk because you're not doing anything and you're losing those strengths, that strength and that balance. So to improve your fall prevention techniques, to improve that, if you are more confident that you may be able to make changes and you may be able to lower your fall risk, and so you lower that fear, you lower those concerns, you increase that activity, that lowers your fall risk. And environmental, clutter, tripping hazards, no railings, grab bars. For me, poor lighting. You got to turn your light on at 5 o'clock in the morning to go down your stairs. The fear of falling can cause people to restrict their activities. The restriction is what they think will reduce their fall risk. And that's the complete opposite. It leads to falls. The falls and fear of falling is controllable, but you have to change your environment. You have to change your behavior and your mentality around that. The majority of falls, they occur during routine activities. Someone may get up too quick to answer the phone, walking to the bathroom at night. Do you have a nightlight? We'll talk about that. Going out to get the mail, tripping over clutter or pets, and inactivity. All those things are things we do routinely in our home and can lead to a fall. Let's talk about inactivity. I have people that never have been active, and then they come and they say, why am I falling? Well, your legs, your ankles, actually the ankles are the most important part of flexibility and balance. Your ankles being flexible, those ankles are what provides your brain with information about how to maneuver your terrain. And as you walk, your ankles make those adjustments. If your ankles are not flexible, you may not get that alert that something is changing in enough time and you may lose your balance. So loss of muscle strength, loss of balance, maybe you're not going out as much as you used to. Social interaction is compromised. It puts you at high risk for isolation, which can lead to depression and anxiety. So fear of falling can actually contribute to your risk of falling. Other risk factors for falls as we age: your vision, poor vision, how many medications you're taking, poor nutrition. Again, I talked about not eating protein, not drinking enough water. All of that can have an impact on how your body responds. Gait and balance disturbances, osteoarthritis. Many people, millions of people have arthritis. And then osteoporosis puts you at risk as well. So vision. As we age, the quality of our vision changes. The change is due, as we're getting older, to the reduction in your pupil size, and that lowers your focusing capability. And also, the pupil controls the amount of light that reaches your retina. So because of the smaller pupil size, older eyes get less light to the retina. So the eye of a 20-year-old receives 6 times more light than the eyes of an 80-year-old. And in dark conditions, 20-year-olds receive 16 times more light than that of an 80-year-old. It's like you're wearing sunglasses in the dark and you're not even wearing sunglasses. So it's very important to get annual eye exams so you can rule out any diseases. Use bright light during the day. And I am a huge component of night lights. My children moved out years ago. I still have a nightlight in their bathroom, which, lights my bedroom. So it's always there. I have a big dog who's dark, and he is next to my bed. So it's very important when I get up during the night for me to be able to see my path. So night lights are great. I had a big fight with my dad many years ago. I gave him a nightlight. I became a master trainer. We talked about nightlights. I put a nightlight in his studio apartment, went to pick him up the next week for breakfast. It was on the counter. I put it back in. The next week, I came back. The nightlight was out and on the counter. Of course, I didn't ask. I put it in one more week. So it was on the counter the next week when I came back. And I'm like, Dad, why are you not using the nightlight? And he said to me, I like it dark. Well, at the time, I didn't realize there were motion detector nightlights, which would have been perfect for him. And so anyway, I lived and learned. And so anybody who likes it dark, get yourself a motion detector, because it'll light up as you as you walk by. Very important for you to visually see. Be careful with new medications. Ask your doctor or pharmacist if that new medication causes drowsiness. There are certain medications that people have to take at night. Or sometimes people are very sensitive. I've heard of people getting their blood pressure medication adjusted, and even the slight change knocks them out. So, if you are on blood thinners, you may need to talk to your doctor about the fall risk, because even a slight fall can be severely, very, very serious if you're taking blood thinners and you fall. We don't want, especially if you hit your head, we don't want you having a massive hemorrhage. Eat healthy, like I already said. Well-balanced diet in order to maintain your strength. You can't not eat and be strong. Okay, whether we like it or not, you have to eat fruits and vegetables, protein, drink plenty of water. I am a culprit when it comes to water. I have to drink more water and I don't. I got altitude sickness going to Colorado because I don't drink enough water. So now before I go, I've got to start drinking tons of water, which I admit I hate, about 3 days in advance, and then all day and all night while I'm there. It's very, very important to drink plenty of water. Older adults tend to drink less water, and that can lead to infections. If you're not drinking water and flushing your system, you could get urinary tract infections from that. Gait and balance disorders are common among older adults and are a major cause of falls. So most changes in gait can be related to medical conditions and should not be considered a consequence of aging. Tell your doctor about any falls you have or difficulty with gait and balance so you can get some treatment. So maybe you need physical therapy to work on those gait and balance disturbances. But here's the thing. I can't tell you the number of people, and it's not just old people, it's younger people too, who have surgery or they have conditions. They go for physical therapy. The minute they're done with physical therapy, they stop the exercises. You cannot do that. You know what? If you don't use it, you lose it. And if you have ongoing conditions that are going to stay with you, then it's important to make those changes in your life, whether it's, physical therapy or at-home exercises. Keep your home free of things if you know that that's an issue. If you need to use a cane, use a cane. It supports you. Get a fancy one. Or I've had people that get a walking stick. They kind of look like Gandalf from the Lord of the Rings. Do whatever you have to do. When I visit my daughter and we go for a walk or a hike, I use hiking sticks. They're great. So use what you have to lower that risk. It does not mean you're incompetent or that you're any less of a person or an adult, or you are trying to maintain your independence. Those things do provide you with the tools to maintain your independence. Osteoarthritis, I'm sorry, I'm being preachy. Osteoarthritis affects 27 million Americans. It's associated with the wear and tear of life. If we're weekend warriors, some of us get, that arthritis quicker than others. It's the breakdown of that cartilage. And as cartilage deteriorates, your bones rub up against each other. It can cause that stiffness and pain. If people feel that stiffness and pain, they will do less, which is not what we want you to do. We want you to maintain your activity or increase your activity. So find out what works best so that stiffness or joint pain is not there. Whether you have to do medication, anti-inflammatories, maybe somebody has to have knee surgery. I know people hate to hear this, but I hate to tell you, weight loss is important. The amount of weight that we put on our joints is huge. And so weight loss is important a little bit. Physical activity. I have seen people have knee replacements and then they sit in their chair and their knee is never the same. Well, the reason your knee is never the same is because you didn't use it and you didn't take that new tool, which was the replacement, and make your leg stronger so that you could get up and do things. I know I'm being preachy again. I apologize. Seen too many things, I know. So osteoporosis is the most common metabolic bone disease in the US. It is low bone mass, and that leads to an increase of bone fragility. It's most frequent in elderly white women, and it is actually called or considered a silent thief that does not become apparent sometimes till people have a fracture. So it's very, very important to keep your fall risk lower so that you don't fall and you don't have a fracture. So remember, there are important things that I want you to keep in mind to help prevent the risk of falls. This is huge. I can't tell people enough. Plan ahead. How many people, and I've known a ton, even myself, that you're rushing? Oh my gosh, you know what? I forgot this or I forgot that, and I'm about to go out the door. I stop, I pivot to go back because I forgot something. And I can't tell you the number of people who said they made a pivot or a turn and lost their balance. And I would ask this question, but I'll tell you the answer anyway. So, what way do people fall the most? To the side. And the reason they fall to the side is because people are changing direction. And when they lose the balance to the side, which leads to hip fractures. Actually, the traumatic brain injury is the number one injury related to falls, but lower extremity is number two, and that's the hip fractures. So plan ahead so you're not rushing. I'll tell you a little secret. Since I was in high school, and if you've heard my presentation before, I'm sure I'm repeating myself, but every night, even now, and I'm an old lady, I put my clothes out for the night before because I don't want to rush in the morning and fall. So my clothes are out. I know what I'm wearing. I'm not standing in my closet for 15 minutes trying to figure out what I'm going to wear. I take my shower. My clothes are there. I put them on. I'm ready to go. I'm in that time period. So that's how I plan ahead. If you know you're going somewhere, make sure you have the items that you need before you go out, maybe on your dining room table, maybe in your kitchen table, somewhere that you can grab everything before you go out. Planning ahead, to me, is huge. Number one, plan ahead so that you're not rushing and you don't fall. Keep the telephone nearby. Now, this is different over the years, but keep your cell phone with you or near you always. Because then if there's a fall or something happens, it's right there. It's with you. Some people use emergency response systems, which are great, but you can also use your cell phone. Some people's cell phones detect, I think the iPhone, the watch, that detects falls. So I don't know I think it asks you, have you fallen? But so there's so many new things now that you can use to keep with you. And we'll talk about getting up from a fall and why this cell phone is important. I'll tell you, my dad used to walk around the retirement community he lived in. It was in a foresty area, and there was a path that went around the whole campus. And he wouldn't tell anybody he was going. So I finally had to say to him, you know, if you fall back in the woods, the deer are just going to look at you and they're not going to be able to call 911 or call the front desk. So I made him, you know, he did have eventually got a call emergency response. So if something should happen on the campus, he was able to press it. So, you know, deer don't help. They're not really good first responders. Clear the way. Oh my goodness. Clear the way. Keep stairs, walking areas free of electrical cords, shoes, clothing, book, magazines, and other clutter. I live with a man that leaves things all over. I have found 3 pairs of shoes next to his chair in the family room. I have also, and who trips over them? Me. I used to walk into our house. I had a son who wore a size 13 shoe, and my husband wore 12s, and they would all be at the back door. Who would trip over them? Me. So now my husband, I found, would put 3 pairs of shoes near my dresser, which was right next to his side of the bed. Who would almost trip on them? Me. So I told him, I said, put your shoes away. His response to me was, what if there's a fire? I go, if there's a fire, you don't need to choose from 3 pairs of shoes. You only need 1. So he starts putting them away. You can teach a dog new tricks. That's okay. We can teach ourselves. We can teach the people that we live with to make those changes, to clear the way. Pets. I've had 2 big dogs at a time. It's, a hazard. I have to be aware of it. I have Akitas and they drink and then they dribble. The water follows them out the kitchen. You got to wipe up the spilled water or food. I have to clear the toys from the stairs. Jumping, if your dog jumps, you better teach them how not to jump because they will knock you down or someone else if they're a big dog. And they're difficult to see at night. So again, night lights, night lights. Get help if needed to remove clutter, clear the walkway. I had a participant in my Matter of Balance class that needed a room cleared out in her house. She knew it, she couldn't do it by herself. She had to ask her daughter. So she didn't want to hear her daughter's discussion during the cleanup or the going through the room. So she actually had her daughter sign a contract. I call it a get help from your family member contract. So it said no sighing. It's on my wall. I got to look at it. No eye rolling, no snide comments, and no lectures while we do this. And she made her daughter sign it. She told me her daughter did it really well till the end. And then she said she got a little snarky. But if that's what you need to do, making a honey-do list, sitting down with your family member or with someone and say, okay, this is my schedule. How does your schedule look? Can you come over this one time and take care of these things for me? You need to do it. Do not get on a ladder. Oh my gosh. Let somebody else help you with things. I have 10-foot ceilings in my kitchen. I have nothing on the top 2 shelves of my cabinets because I don't, I stopped climbing on my kitchen counters to get things. I don't do it anymore. I don't get on chairs anymore. So get help. Remove clutter. Get somebody else to clean your walkway. It does have to be cleared. Slippery when wet. Use non-slip mats in the bathtub and on shower floors. Install grab bars on the wall next to the bathtub, shower, and toilet, and wipe up spills immediately. If you have to throw a towel down, sit down and just wipe the floor with your foot, clean it up. But the bathroom can be a very risky place. So make sure that you make it a safe place by putting in things, if you have mats or rugs in there, they better not be moving. There's a reason that things are called, well, I'll get to that. Night lights again, light the pathways in your bedroom, your hallway and bathroom. I've seen ones that you literally can just stand up and they're motion detected. So it's almost like a runway. So if that's what you want, when you walk through the hallway at night, it'll go on and light your way, okay, as you walk down the hallway. This is what I was going to talk about. There is a reason that throw rugs are called throw rugs because they throw you. So use only rugs with rubber non-stick backing. If you do have a rug, there's lots of 2-sided things that you can put on the bottom of it that prevents them from moving. Always smooth out wrinkles and folds in carpeting. I know people love their rugs and stuff, and even some seniors. My coworker who used to be our trauma coordinator here and was a master trainer with me, she used to go to Florida to visit her aunt, and her aunt had wall-to-wall carpeting, 11 by 14 rug, 8 by 10, and then under her ottoman, a 5 by 7. And every year she would go and remove all the rugs. And every year she'd come back and the rugs had been born again. So there's no reason. First of all, if you have that many rugs, you can't feel the floor. And so that will also make it difficult for you and risky to walk. If you use an assistive device in your home with rugs, you have to be careful because they can get caught. So you want to make sure that those rugs are safe and that you're safe. Tread careful. Stairways, again, should be well lit, top to bottom. Handrails on both sides for full length. If you don't have a railing, but have like on top of a wall, sometimes you have that 1x6, at least you can hold on to that. Very, very important. Do not walk down hardwood stairs in socks or slippers unless the slippers have that bottom rubber. All right, how many people still wear their shoes like that? I don't, I never have. You gotta wear well-fitted shoes. You need sturdy footwear. Again, flip-flops are called flip-flops for a reason. They flip and flop you. I actually was bad. I was at a doctor's office and there was a woman walking in the parking lot. She had flip-flops on and her pants were about 4 inches too long. And she was walking very slowly. And I opened my mouth and I said very nicely to her, I said, those flip-flops, are dangerous. You should try to get some better fitting shoes so you don't trip on your pants. And she kind of gave me a dirty look and walked off. But I had my say. I tried to help. Alcohol. Alcohol can make you unsteady. If you need to have a nightcap, do it right before you go to bed, okay? And limit your alcohol consumption because you can fall from that. Phone a friend, okay? Daily check-in with friends or relatives. Maybe even consider a medical alert system if you spend a great deal of time alone. But it's very important to have people, either you check in, you set up with a friend, well, I'll call you, you call me, just so we make sure each other is doing well. It's very important. Some of the most damage that really ends up causing the traumatic event is not when you actually fall. The most damage occurs if you're laying on your floor for long periods of time. Exercise. And it doesn't have to be where you're, running a marathon or you're on an elliptical for 60 minutes. Walking is wonderful, but set realistic goals to increase your activity. Don't not do anything and then the next minute go, okay, I'm going to work out 5 days a week. I'm going to get an exercise bike and then I'm going to lift weights. Well, if you come from doing nothing, you probably are not going to do that. So set your goals realistically to increase your activity. Exercise is the key to increasing your strength and improving your balance. Okay, staying strong, staying flexible. And again, don't forget about those ankles. That is what improves your balance and can lower your fall risk. Don't ever, if you're a younger person, and I mean 40s or 50s, don't stop doing things. Don't stop being active. All right. I'll never forget one of the biggest incentives for me to start working out on a regular basis about, I don't know, it was probably 21 years ago. I was doing a presentation at a community center where there's a senior program. And actually they were watching because one of their seniors was actually on the Oprah Winfrey show. And she was talking about, she was now 86 and she started working out at 42. And even though we have to alter our activity as we get older, so we make those adjustments for our ability, she was still lifting hand weights and she was still being active and doing exercise programs at her local community center. So that was a huge incentive to me when I was 40 years old, actually 42, to start working out regularly, incorporate it into, my daily living. I heard somebody say that exercise or doing activity is like my other medication. And that is true. It should be incorporated somehow, whether you take a walk every 3 times a week, or you walk around a mall, or you walk around a community center, or you do an exercise class somewhere, or you work out at a fitness center, whatever it is, don't stop. So we have some important reminders. Plan ahead. Put out your clothes the night before. No, I'm kidding. You don't have to be as anal as me. Exercise or improve your activity level. Take your time. Please do not rush. Plan ahead so you're not rushing. Ask for help. It is not a crime. You are getting people to help you so you maintain your independence, not put your independence at risk. Use night lights where you can. If you want, install grab bars or make things safe. Some people use shower chairs, so they're not getting, standing, but they need the grab bars in their bathroom and bathtub to get in and out. Avoid those throw rugs or make them safe. Wear sturdy, good shoes. No flip-flops. I know it kills me too. Set realistic goals to increase your activity level. All right. It has to be realistic. You have to enjoy it. It has to be something you enjoy doing. Make sure you enjoy it. So I did talk about the Matter of Balance class. That is a national program that Advocate here at Good Shepherd, we are involved in. There's many senior centers that provide Matter of Balance. It is an 8-session class. It teaches or it helps participants manage their concerns about falls, look at different strategies to lower their fall risk, and there are some very easy exercises that you can use to improve your strength, flexibility, and your balance. These classes are small group classes. You can only have up to 12 people because you want the discussion. My father never learned from me because it was like, remember from Friends, yada, 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 yada. That's what he heard out of my mouth. But when you're in a small group like this, or you're doing exercise at you have a senior center, people share together and they learn together. So they're much more willing to make those changes. Okay. That's the hard part. It's really making those changes, Again, I hate it when I see those spiders, but I don't climb on my bathroom counter anymore to kill them. All right. And that was a huge adjustment for me. So thank you very much for listening. I am the Senior Services Coordinator out of the Senior Services Department at Advocate Good Shepherd Hospital. Also, our Trauma Services and Emergency Department. We're very active in getting us involved in fall prevention, both inpatient, they have fall committees, as well as providing programs to the community to help people lower their fall risk. Because falls, I tell people, you can't come to our emergency room and we will not give you a pill and say, here, take this pill. You won't fall anymore. It doesn't exist. It takes us working on ourselves to make those changes that are necessary to stay independent so we can live a wonderful life.
So thank you so much. What an excellent presentation and a lot of good tips. And I did see myself in there a few times, so that's rather fresh, of course.
I'll be talking to you later, Carol.
Yeah, exactly. I could use it, believe me. But I think it is true. And I think as we age, we are all, well, just normally, people are afraid to ask for help, but I think it is a very important point and it's a good starting point as well. And thank you for mentioning the matter of balance sessions. I would also mention that with ElderWorks, we have stepping out to fitness, and you can do that online on your own and then report in, and we do certain prizes and things. We used to do them on a quarterly basis. That's going to be running all year now, quarter to quarter. So by all means, you can join us in that as well. Do we have other questions?
And there's a
Someone,
couple.
yeah, did you want to, you can see them. Did you want to go ahead and address those?
Oh, the first question, before it started, somebody wanted suggestions for getting up if you do fall. So if somebody can, here's the issue. If you fall, the first thing you need to do is to make sure you're okay. So you're sitting there, your feet are out, you've fallen down, you've hopefully propped yourself up a little bit to a sitting position. If you think something has happened, then that's why you have that phone. You got to call 911. If you think something's broken, you're in severe pain, you've hit your head. But if you have assessed yourself and everything seems to be okay, we tell people to scooch if they can, if you can support your body weight with your hands, to scooch to the nearest couch or chair, okay? The big issue here is either pulling a pillow or a cushion down on the floor in front of you, now you have to be able to get on at least one knee. So you propped yourself, turning that you're on one knee, and then you're on that knee and you're near that couch or chair and you're gonna lift yourself, turn and sit. Where I see people have problems is if they've had both knees replaced and they can't get on both knees, then you better have an emergency response system. There's nothing, there's no magic, pill, or there's no thing. You got to call 911, because if you can't get up, if you're hurt and you can't get up on your own, scooch to a chair, pull down that cushion, pivot yourself onto, if you can, not all fours, but maybe all threes on one knee, right in front of the chair. Put your hands on the arm or the cushion on the couch and pivot yourself with your rear end then on the couch or the chair. But if you cannot do that, you are going to have to call if you cannot get up.
And I think that's very good advice. And I had a friend that fell out with her dogs one night and had left her phone in the house, which wasn't her usual thing. And she had to scooch on her back.
Yeah.
Down. She was only one house over. It took her 2 hours to get to the top of her driveway. No one had finally somebody came by. She suffered from that for about 10 months afterwards, trying to get back. So, and didn't break anything. So it is difficult. And I think that as seniors, we don't have the strength in our legs or in our arms that we used to have. So even being able to get on your knees and hoist yourself up, so to speak, or push yourself up, it's a trick.
Right. Well, and that's the thing is, yes, you have to have a little bit of upper body strength. If I had the ability, I would get on the floor and show you, but it is where you get to that. If you can scooch back and get to that closest couch or chair that's not really high, it's not going to be your bed. The bed is going to be a problem because how many beds are, really high off the floor. So either have somebody that you can call, or you have that cell phone or that emergency response button. There may not be another alternative.
The other thing you had mentioned, Sue, was the Apple Watch. And
Yes,
I have a couple of clients that just looked into this recently, and I was at Apple myself, and so I was asking about it. What I would say is, I think it's the easiest, perhaps less intrusive device for seniors or for anyone really at this point. I had someone else who was looking at getting an alert system, and by the time they got all of the devices and what they had to set up, they said, this is so much more equipment than I need. And they ended up, because they were quite mobile, so they ended up getting the Apple Watch.
Mhm.
What's important is, and I would suggest, because we all are so into ordering online now, but I would strongly suggest to go to Apple and talk to them, because there's different levels that do different things.
Right. You need someone to show you how to do it.
Exactly. And
Yeah.
you need to be sure you've got the correct one, because they don't all just call or call automatically or connect with your phone as well. So there's a lot of ins and outs on it, but
Yeah.
it's, I think, an excellent option.
Yeah. And I apologize. I am not able to share the slides. I apologize if,
That's
I-
fine. We don't
my
share.
hands,
Yes, and I should have said that ahead of time. I'm sorry, and announced it. We unfortunately are not able to share the slides for any of our presentations for the
right,
most
they're
part.
copyright.
Right. However, go on to our YouTube channel. And this will be on probably by tomorrow or the following day, and you can watch the presentation again.
So somebody asked you, do you have tips for navigating steps besides the one you gave? So if somebody's having issues with steps, there's so many reasons why, besides, wearing sturdy shoes, having railings on both sides. I'm not quite sure if if they have to use an assistive device. There is an actual way that I had to do when I had knee surgery and using crutches. There is a way of how to get down and how to get up using an assistive device. Again, I guess I'm not sure what the reason there's difficulties navigating steps besides the general information. I don't know if that person is still around.
Yes, I think they are. You could unmute yourself or type in another question on chat. I think she's unmuted herself.
Okay.
Yeah, I'm just asking whether there's some general guidelines you have about navigating steps in terms of holding on, or one step at a time, or
Oh,
step and then
yeah.
step together, or if there's some methods that you think are safer for going both up and down stairs.
Well, I know that when you're going down steps, you don't realize this, but you actually lead with your weaker leg so that your stronger leg is up top with you still. And I would put one foot down, bring the other one to the step. But if managing the steps are difficult for you, one down, then the other, one down, then the other, holding on, lights on. The big issue is paying attention. Don't carry anything, and these are just this is what the issue is with falls. All this stuff is common sense, and none of us do it because we don't follow common sense. Okay. If you have something to carry, it's laundry, throw it down. Who cares if it gets wrinkled? It's dirty. So if you have to, some people put things in like a bag with a drawstring and throw the bag down, or drag it with you. But always watch the steps that you're stepping on. That is why they're looking straight ahead, and missing the steps is the biggest problem. I have the 3 times that I've fallen down steps, I missed 2 steps. Twice was in the hallway going downstairs in my house. The other time I was going down the 2 steps into my garage and I was looking out at the driveway, and that really hurt because my garage floor is concrete. So I not paying attention, taking it slow. I would not, if you don't want to do one foot, then bring the other, 1 foot, then bring the other, then make sure you're holding on. And if you're going down using 1 foot on each step, you need to watch where you're going. I just can't stress that enough.
Very good advice. Thank you.
If there's any, if somebody has a balance issue, I don't think people realize that if you have a really bad balance issue, you can get an order sometimes from your physician to go through some physical therapy and work on strategies that you can use in your house. Yeah, I like this. Watch where you're going, not where you've been.
Right.
Or watch where you're going closely, not where you want to go. You just have to take your time. And I'll be honest with you, I have to do this every single day, every morning, because I am a multitasker. And if you have a habit of being a multitasker, you can fall down your stairs because you're not paying attention. I know, my dad used to introduce me as the boss. So I know I'm bossy. I apologize.
Well, it keeps people safe, so that's okay, Sue. We enjoy it. And you do it with a smile.
Good.
Do we have any other questions?
Oh, great. Somebody said they do strength exercises and this has helped immensely. Yes. Yes. Either, like I said, get with a physical therapist, get with a trainer, go to classes at a senior center or at a fitness center. You can't not use your legs and expect to not have, mobility problems. You've got to work on keeping, even marching, even walking, you're working on your quads. Even doing little squats, little ones, even doing stretches, all of that is helpful. Keep those legs working.
Thank you, Sue. Well, I think on that note, we're
Oh.
at sort of the end of the time. And
Oh, great with the boxing. That's all.
yes,
Okay.
we had another note here that there's a friend that's been doing boxing for balance and he's been fall free for 8 months. So very good. Yes. Everyone has great suggestions. Thank you so much for joining us, Sue. Thank you very much.
Thank you for
We
having me.
appreciate the partnership, and certainly you can always contact us direct and let us know if there's anything else we can do. And ElderWorks is always here to help you with any of your senior needs and resources. Have a great day, everyone. And remember, this will be on our YouTube channel.
Take care, everybody.
You too. Thank you.
Stay
Sue.
safe and well.
Yes.